Pramila, you can start.
We warmly welcome each one of you to today's session, which marks the final webinar in our Day10 Mental Health Awareness series in English. We continue these webinars in Telugu from 4th August to 19th August to make it more relatable and understandable for all the communities across. We request you all to share and pass the information so that a larger group of our society get benefited from these free webinars in Telugu too. We are truly grateful to see you here for our webinar series on psychological disorders, triggers to treatment, an initiative led by us, a passionate group of psychology students as a part of our diploma under the guidance of Dr. Geetha Challa and Mrs. Vijay Lakshmi. Just a second. I, Remila, with my friend Aisha, are going to take you through this emerging trends in treatment modalities for psychological disorders. Aisha, are you ready? All set to go? So before taking for the recap, I would like to mention about Manojagrithi, established by Dr. Geetha Challa in 2012, is a non-profit organization with a vision to create mental health awareness and preventing mental health issues, contributing to a healthy nation with strong values. Over to Aisha. Aisha, I think you have to unmute.
Dr. Geetha Challa, child and adolescent psychologist, director and foundation of Manojagrithi and Sudisha. What is it?
Little louder. I would also mention that Geetha ma'am makes herself truly stand out to her grounded nature, good sense of humor, and her ability to connect with people at a personal level, irrespective of the age. She is someone who can correct with kindness, motivate with wisdom, and still bring a smile on our faces. We are honored to have her support and guidance in this journey of mental health awareness. Before we move further, I also take this opportunity to thank our Sahaya course coordinator, Mrs. Vijay Lakshmi. She has been there with us at every stage of this journey. Thank you, ma'am. Over the past 9 days, we have taken you on a journey exploring a wide range of psychological disorders that affect millions across all ages, backgrounds, and also the lifestyles. Our mission throughout this series has been to bring awareness, compassion, and clarity to topics that are often hidden in silence. Let's take a quick moment to reflect into our journey. Day 1, we began with an overview of psychological disorders, setting the stage for awareness and understanding.
Day 2, we explore generalized anxiety, the constant worry and uneasy that can silently affect daily life.
Day 3, we We addressed sensitive hormonal linked challenges like postpartum depression and premenstrual dysphoric disorder, conditions often overlooked.
Therefore, we turn our attention to young minds, to childhood disorder, lifestyle behavior, and development.
Day 5, we tackle phobias, from fear of heights to social situations, and how these intense fears impact real life.
Day 6 shows the components of mind and system and other psychotic disorders.
Day 7, we navigated through the emotional waves of major depressive disorder, and our webinar on bipolar disorders highlighted the highs and lows that challenge emotional stability.
Day 8, we uncover the hidden repetitive pattern in OCD, that is, obsessive compulsive disorder.
Yesterday's session, that is day 9, regarding the rising impact of internet-related disorders in today's digital age. Each of these sessions opened important conversations, not just about symptoms and stigma, but also about the need for timely, effective treatment and support. We would also mention that the webinars which are being conducted for past 9 days, including today and also the coming up webinars in Telugu, they are available on Manojagrithi webinars homepage, which are available for any individual to have a quick run through to have a little awareness about it. So the slide which is reflecting, you can definitely look into it, which is available, the recorded videos. So today's transition to the topic, emerging trends in modalities, and today covering with all the 9 webinars, we come full circle. After understanding the why, what and why of psychological disorders, we now focus on the how of healing, the treatments, therapies, and evolving approaches that support recovery. We will journey through time from ancient treatments like herbal remedies and rituals to modern scientific advancements. Mental mental health treatment has come a long way, just like how physical medicine has evolved. Today, we know that mental illness is not a weakness. It is a medical condition, just like diabetes or asthma. And just like a broken bone needs both rest and physiotherapy, medical health also requires a multi-dimensional approach. For instance, imagine someone with a fever. We look for the cause, give medicine, and also give supportive care like fluids and rest. Similarly, a person with depression may need therapy like CBT, medication, and very importantly, emotional support from family and friends. As we very often come across, prevention is better than cure. We most of the times hear this with regard to physical health. Same way, mental health also thrives with early interventions. Just like regular exercises prevent heart diseases, practicing mindfulness and stress management can prevent anxiety or burnout. Our goal today is to walk you through this evolution of treatment, highlighting not only how far we have come, but also the many options now available that are helping people lead more balanced and fulfilling lives. So whether you are a psychology student, a caregiver, or simply someone who wants to support mental wellness in your family or community, this session is for you. Let's begin this session with the same curiosity, compassion, and commitment we have carried through this entire series. Over to Aisha.
Yeah. I'm audible, ma'am?
Yes.
Before jumping into the topic, I will like to settle down all your senses. and relax through mindful breath and grounding technique. Breathing is a natural rhythm of inhale and exhale. Let's sit comfortably. Remove all your accessories. Sit straight. Keep your backbone straight. Place your both hands on your knees. Close your eyes gently. Make sure your feet should touch your ground. Relax your facial muscles. Relax your jaw. Drop your shoulders. Relax all your body muscles. Relax, relax, relax. Now bring your awareness to your breathe. Inhale, exhale. Inhale, exhale. Inhale, exhale. Don't try to change your breath at any way. Just observe it as it is. Thoughts may come and go like a wave in the ocean. Don't run behind the thought. Focus on your breathing process. Inhale, exhale. Inhale, exhale. One more time. Inhale, exhale. Just observe the breathing. Relax, relax, relax. Now slowly breathe in, breathe out. Just observe the breathing pattern. Relax. Now let us do deep breath. Inhale and exhale slowly. Increase the length of your inhale. Count 10 and without troubling yourself, exhale slowly for the count of 10. Now inhale 1, 2, 3, 4, 5, 7, 8, 9, 10. Now exhale slowly 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do not trouble or force yourself during the process. Let us continue deep breathing for 2 more times. Inhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time. Inhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep your eyes closed. As we know, we are connected our body with our 5 senses. Because our lifestyle, there is a overconsumption of senses, though we need to get them grounded. Let us tap into the 5 senses. We will go each one at a time. Close your eyes and do this mindful activity. Now get focus on 5 sounds getting around you through your ears. Sounds that you can hear now. It may be any sound, horn of a car from so far, fan sound. It may be your heartbeat, barking of the dog, any sound, just to be judgment. Just notice with your full focus. Now, let's move to sense of touch to feel 4 different texture with the help of your right or dominant hand. Whether it is your dress, your palm, surface of your chair, your hair, feel the texture, how it is. Is it rough or smooth? Be non judgmental. Keep your eyes closed. Focus. Now, let's do the sense of smell. 3 different smells. Round smell. They may be your palm. They may natural fragrance of your room, your dress, or any other object. Don't be judgmental. Just observe. Now, rub your hands. Place them on your eyes. Feel the warmth. Whenever you feel comfortable, gently open your eyes. Now, tap into sense of sight through your eyes. Now, see the 2 things around you. Just observe the texture, color, size of the shape of a thing. Be non-judgmental. Maybe table, your phone. Now gently tap into the sense of taste through your tongue. Look at the fruit. Notice shine and color. Touch it. Feel the texture. Smell it. What memories or feeling rise? Take a small bite of a fruit and focus on your flavor and texture. Feel the texture. What feeling arises? Place it on your tongue. Don't show, yet notice the sensation. Now, chew slowly. How does the taste change? What does your mouth do automatically? Now, relax, relax, relax. I hope you all are relaxed. Now, over to you, Pramila.
I'm sure that all the audience got relaxed. Yes.
Yes, ma'am.
So
Think
now
so.
let's get into our topic: emerging trends in treatment modalities for psychological disorders. My screen is getting stuck. Just a minute. Now let's understand how this evolution from ancient till date it has been there. How many of you remember? I still remember my own childhood days or college days. If we have to tell even a word that I have to get down near Eragada, I don't know how many of you are familiar with this stop. If we have to go by RTC bus stand, uh, people used to make fun of it that she has to go there. But now, out of innocence or ignorance, we were talking. But in today's scenario, there is lot of awareness and being very mindful in terms of when we talk about any mental illness. So that has been very evident for us to notice. In that regard, a future psychologist and mental health professionals, we often learn about traditional therapies and medications. But the world of psychology is constantly evolving, integrating technology, neuroscience, and holistic care to improve client outcomes. Today, we will explore innovative treatment approaches that are shaping modern mental health care, from neurostimulation to digital interventions and even nutritional psychiatry. It was once believed that people with psychological disorders were influenced by demons. These people were forced to imprisoned. Later, asylums were built for these mentally ill people, and but the patients received very little or no treatment, and maybe sometimes the methods were very cruel. Today, there are psychiatric hospitals run by governments and local community hospitals with the emphasis on short-term stays. A person suffering symptoms could speak with a primary care physician who most likely would refer him to someone who specializes in therapy. The person can receive outpatient mental health services from a variety of sources, including psychologists, psychiatrists, therapists, school counselors, clinical and social workers. With the rise of the modern medicine and psychology, the focus shifted to biology and behavior. In the 19th and 20th centuries, psychoanalysis, asylums, and early psychiatric medications emerged. Over time, these approaches were refined through evidence based therapies like cognitive behavioral therapy, we call it as CBT, and later the wave therapies of first, second, and third waves. In today's era, we combine the best of many worlds, from psychotherapy and medications to brain based interventions like TMS and genetic treatments, while also embracing mindfulness, lifestyle medicine, and integrative approaches. This evolution shows us that healing the mind isn't just about one method, it's about adapting a new understanding while respecting holistic wisdom. Let's look into few methods of treatment. That is, the first one is neurostimulation therapy. It is a modern advancement in the treatment of psychological disorders, especially when traditional methods like medication and talk therapy haven't been effective. These therapies involve stimulating specific areas of the brain using mild electrical or magnetic pulses to help reset or regulate the brain activity. In this process, the depression is proven is what we could understand throughout our research and throughout our course that we could do. And the other kind of disorders are being still in the process, and few under approval and few under still R&D which is going on. So when the brain needs a little reset by stimulating or to be activated due to some mental illness, when the talk and medications may not be sufficient, that's where the brain-based treatments come into ECT and repetitive transcranial magnetic stimulation, also known as magnetic wave therapy. ECT, how many of you remember watching in movies giving that shock treatment? Yes, you can type in the chat box. Have you seen in any movies? Aisha, any responses?
Yes,
Yes,
mom,
mom,
they're
they're
saying
saying
yes.
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 Almost
Almost
they're
they're
saying
saying
yes.
yes.
So it is so scary. It is not the same how they show in the movie, but in reality, it's a safe and well-regulated medical procedure and used when someone is severely unwell, especially when they are not responding to medications. It is just how that happens, how that what happens in ECT is a small controlled electric current is passed through the brain for a very few seconds while the person is under anesthesia. This creates a very short seizure which can help reset the brain's chemistry, and mostly it is used in severe depression where a person has stopped eating, speaking, or even at a risk of ending the life. In treatment like schizophrenia also, this ECT is happening, and this ECT is also is given when to for the fast relief when it is needed, and when the medications are not effective, as I mentioned already, and when the patient's symptoms are very severe. So, coming to the next, let's quickly understand the waves in the psychological therapy. The first wave, it is the approach is behavioral therapy, that is, changing behaviors will be the focus area. The second wave is about cognitive behavioral therapy, where the CBT and REBT will be taken care by the therapist, introduce thoughts, beliefs, and cognitive restructuring, and they focus on challenging the negative thoughts, that is, rephrasing the negative thoughts. The third wave has been very, very effective these days, the mindfulness and the acceptance based approaches. When you talk about all these days, we were being taken you to experience the grounding technique. Mindfulness is all about where we focus on the taste. When you say that is the mindfulness, if I'm right, and accepting the thoughts rather than fighting with them, and then living meaningful despite inner experiences. So, the third wave therapies in mental health is all about having mindfulness, acceptance, value based living, cognitive awareness, emotional openness. So, the picture speaks. If you see, there are four types in the third wave therapies. One is the acceptance and commitment therapy. Helps people to accept what they cannot control and commit to actions aligned with their values. At the same time, encourages psychological flexibility, the ability to be present, open, and take value driven steps. If you see the picture, being in your own thoughts, observing your thoughts means you are mindful there. A person with chronic anxiety learns to notice anxious thoughts without fighting them and still attend social events that align with their goal of building friendship. The same way, mindfulness based cognitive therapy, it is the therapy which is the combination with the CBT for the depression relapse prevention, designed to prevent relapse in depression, especially in people with recurrent episodes. These therapies focus on acceptance, mindfulness, and psychological flexibility rather than just symptom elimination. When you say relapse, the person is very mindful that maybe if the thoughts are reoccurring, they know how to manage. So, body scanning is one of the best example when we notice that our body, when you just sit and put your hand on your stomach, this is something that you feel, and the body scanning activity and many MRI activities are being taken by Geetha ma'am and Vijayalakshmi ma'am for all of us to experience. And some example, if I say, another example, someone who has recovered from depression learns to be aware of early signs of relapse and uses breathing, mindful movement, and thought awareness to stay balanced, which they are being experienced by the therapists. Dialectical behavior therapy, DBT, is originally developed for borderline personality disorder but now used more widely. This teaches skills in distress tolerance, emotion regulation, mindfulness, and interpersonal effectiveness. A person with intense emotional swings learn DBT skills to pause before reacting, tolerate emotional pain, and express needs clearly in relationships. Compassion focused therapy. This helps people who are with high shame or self criticism to develop compassion for themselves and others. This technique, this therapy encourages them to soothing system in the brain instead of threat system. So, someone with childhood trauma and intense self blame learns to visualize a compassionate inner voice and respond to their own suffering with kindness. The key principles of this third wave, what all I have just run through the slides, this is the gist of it. It summarized to summarize the principle of this third wave with mindfulness. It is being present in the moment without judgment. This is very, very important. We generally jump into the judgment. So acceptance, allowing thoughts and feelings to come and go without any struggle. That's why when our counselors were taking you through the breathing exercises, they were mentioning that let the thoughts come in, let the thoughts run, but do not invite the thoughts or do not go behind the thoughts. So this is acceptance where you allow the thoughts and feelings to come and go without any struggle. Values, living according to what truly matters to the individual. Self as context, seeing oneself as more than just one's thoughts and emotions. Psychological flexibility, adapting to life with openness and resilience. Now coming to the next therapy, expressive art therapy. Very, very effective therapy this is, where a therapeutic approach that integrates body, mind, and emotions through creative expression. Key purpose of this therapy is to help individuals explore and align inner emotional world with bodily sensations and cognitive awareness through artistic expression. How it helps in aligning the body, mind, and emotions is this therapy helps body through movement like dance, sensory activities, and muscle memory awareness. Mind helps to process thoughts symbolically, improves cognitive flexibility, reduces mental rumination, provides a safe outlet to express suppressed or intense feelings non-verbally, example via painting. When words are not enough, creativity speaks. Few more examples connected to the expressive art therapy, drawing, painting, or sculpting to explore trauma, reduce anxiety, or express difficult emotions. Music therapy, playing instruments, listening to music, or songwriting to process grief or improve mood in depression. Dance or movement therapy, using body movement to release stored emotions, manage stress, and reconnect with self. Drama therapy, role playing or storytelling to work through interpersonal conflicts, self identity, or past experiences. Poetry or journaling, writing poems, letters, or free journaling to express suppressed emotions or gain insight into thoughts. How many of the audience agree that expressive art therapy will be definitely a relaxation mode? Yes, these days it's been very, very common that irrespective of the age, we started joining in some kind of skill classes. Yes, Aisha, any
Yes, they agree, ma'am.
responses?
Yes, the writing
Okay,
it's agree.
okay, great. So next is the integrative and eclectic approaches in psychotherapy. Sometimes one single therapy method is not enough to help a person because everyone's mind and life are different. So therapists use integrative or eclectic approaches where they combine tools and techniques from multiple therapies to suit the person's unique needs. The therapist picks what works. The eclectic approach means selecting techniques from different therapies based on what seems most useful for the client. It's like a therapist having a toolbox and picking the right tool based on the client's problem. For example, using CBT for thought patterns, relaxation for mindfulness, and communication skills for DBT. Example, a therapist helps a teenager with anger issues by using CBT for thoughts, breathing techniques from yoga, communication training from DBT, behavioral techniques to manage outbursts, and at the same time, family therapy to improve communication at home. So there are few psychological disorders where eclectic approach is very, very effective. Now moving on to integrative approach, a powerful and client-centered model of therapy. While the eclectic approach blends tools from different therapies based on what works, the integrative approach goes one step deeper. It creates a unified, thoughtful model that brings together theories, techniques, and even cultural values into one coherent framework. In simple terms, integrative therapy is about treating the whole person, not just about symptoms. For example, an integrative therapist might use CBT to help challenge negative thoughts and person centered therapy to build trust and self worth, incorporating mindfulness to manage stress and explore early life experiences if they are impacting current patterns. The goal is to address thoughts, emotions, behavior, biological needs, social and spiritual factors too. This approach recognizes that mental health is multidimensional and so treatment should be too. Unlike using a single tool for every problem, the integrative approach is like building a personalized care map where each method complements the other to support lasting healing and growth. In short, integrative therapy is not just about mixing methods, it's about merging them meaningfully to support the mind, body, and soul. So, these approaches are very much helpful when one size doesn't fit all, and making it flexible based on the client needs to make it more personalized. Coming to psychopharmacology, this is all about the medications. When the other therapies are not effective, then the medication also will be coming into picture. And there is a misconception for me that before I was studying this course, I was every time having an opinion that the medicines have the side effects. But here, if we go to a certified practitioner, certified psychiatrist, I think they definitely prescribe based on the need for the medication. So the pharmacology innovations in mental health treatment is all about study of how medications affect the brain and behavior. It deals with using medicines to treat psychological disorders such as depression, anxiety, and any other few more psychological disorders. And along with this, I do remember in one of the webinar, someone was asking Geetha ma'am that if the medication is there, how long this medication should be taken care. But Geetha ma'am was very much suggesting that along with the medication, the therapies are very, very important. So it should complement and get the relief, faster relief from the symptoms, fewer side effects, better quality of life, hope for people who didn't benefit from other medications. So, psychopharmacology is not just about pills, it's about restoring balance in the brain to improve the quality of life. Now, I would request Aisha to take over from here.
Yes, ma'am. It's a nice info, ma'am. Now, topic we start is what is genetic treatment? Genetic treatment in mental health refers to using a person's genetic information to understanding their risk for certain mental illness, predict how they might respond to psychiatric medication, chooses treatment that are morely likely to work for them personally. It is step towards personalized medicines and in psychiatry. Let us see why this is important. Traditionally, mental health treatment involve lots of trials and errors. Try these medicines and see how you feel. Side effects may occur before improvements are seen. Some people don't respond well to common medication. Genetic treatment help avoid this by using science to guide decisions. How does it work? Pharmacogenomics, the most common form of genetic testing in therapy. It studies how your gene affect your responses to drugs. Example, two people with depression may take the same antidepressant. One feel better, the other feel worse, get side effects. Genetic setting testing can reveal difference to how their bodies metabolize their drugs. Based on the test, doctor can select better medication and dosage. Next we see benefits of genetic treatments. Advantage descriptions. Reduce trial and errors. Help find the right drugs faster. Fewer side effect. Avoid medication that don't suit the person. Save time. Faster symptoms, relief and recovery. Personalized care. Treatment designed for individual, not the group. Every treatment has its limitations. Not a standalone solution, therapies and environments still matters, still expensive, and not widely available in all regions. Only some mental health conditions have clear genetic markers. Now, next topic is trauma-informed care. What is trauma? Trauma refers to the deeply distressing or disturbing experience that overwhelmed an individual's ability to cope. It can affect emotionally, psychologically, and physically well-being. Trauma-informed care. Trauma-informed care is an approach that understands the prevalent and effect of trauma, recognize the sign and symptoms of trauma, integrates the knowledge of the practice and policies, seeks to actively resist re-traumatization. Now we'll see benefits of trauma-informed care. Promotes healing and recovery, enhance provider-client relationship, reduce burnout professionals, increase client engagements and satisfaction. Now, animal-assisted therapy. Ma'am?
Yes, Aisha. Shall we ask audience that how many of them have pets at home?
Yes, ma'am.
Audience, can we request you to just mention in the chat box like if anyone have pets at home? Can you see any responses, Aisha?
Yes, ma'am, they have.
Okay.
Thank you for your responses.
Yes, we can also ask like what kind of, before Aisha can get into the slide, what kind of feeling or what is been relevant to the slide? Can anyone specify? Did you ever noticed when you take the pet into your hand or when you spend time with that?
They're typing yes.
Okay. Okay, Aisha, you can relate to the chat box
Thank you for your
response.
responses.
Yes.
Animal assisted therapy. Animal assisted therapy, also known as pet therapy. It's a therapeutic interventions that utilize animals to improve a patient's physically, socially, emotionally, and cognitive functioning. The benefits of the human animal bonds: improve physical and mental health, promote conversations, improve self esteem and confidence, positively impact social skills. Animals are not judgmental, inhabit, inhibit the productions of the stress hormones, cortisol, reduce anxiety, reduce stress, reduce blood pressure. Now we'll see what animals use for therapy. All animals we can't use. Let's see which we can use. Dogs, most common, friendly, trainable, economically responsive. Horse therapy, strong non-verbal, communicational, build trust, promote responsibilities. Cat, calm, present, less physically demanding, suitable for indoor environment. Rabbit, soft, small, threatening, easy to hold. Birds, social, colorful, can mimic speech. Dolphin therapy, rare and expensive, engaging, intelligent, soothing aquatic environment.
So can you
Now,
read out the audience responses in the chat box, Aisha? As I'm presenting, I may not be able to see. Is there anything which we can relate to it? Can you read out?
yeah, ma'am, I'm just trying. Animal are not judgmental. The
Okay.
unconditional love from the pets.
Yes.
Yeah.
Thank you. Thank
Can
you,
we move
audience.
on?
Yeah.
Virtual reality therapy. Now we'll see what is reality therapy. It is innovative approach to mental health treatment that use computer generate 3D environment to stimulate real life scenarios, allowing patient to safely face their fear and anxiety. How it work? Assessment. Identify the psychological issues and set therapy goals. Immersions. Patients wear headset and enter the triload VR environment. Interaction. Client interact with the scenarios. Example. Given a speech, walk across a breach. Processing. Therapist guided reflect and behavior or cognitive reframing. Now, nutrition therapy. What is nutrition psychiatry? Nutritional psychiatry is an emerging field that focuses on relationship between diet and mental health. It explores how the foods we consume can affect our mood, cognition, and overall mental well-being.
Yes, Aisha. Here, can we ask audience, do they agree that the food intake have an impact on the mental well-being? Can
Yes, ma'am.
anyone
Sure.
give any examples if they have seen anything or heard anything or experienced? I can also share my experience.
Yes, it has impact.
Okay. Can any one of them give the examples?
Please type examples in chat box. Dark chocolate.
Okay.
Yes, when I don't eat, I will tired and cannot focus on work.
Okay. Any other?
Chocolate aggravated.
Vitamin D. When the intake, even recent sessions, the same ma'am was telling, if the vitamin D intake is very less than what body exactly needs, we get into low mood. And the same way, high sugars and high salts should be avoided. The specialist, the doctor suggests that if any child is diagnosed with ADHD, the high sugars and high salts to be avoided. So these are very, very important, that diet plays a vital role. Yes, Aisha, over to you.
Yeah. Goal of nutrition therapies. Lifestyle areas supporting mental health. Diet and nutrition, mind, body, and mindfulness practice. Sleep, social connections, avoiding harmful substance, physical activity. Yeah. Nutritional therapy. Explore the link between diet and the mental health, suggesting that choices can be significantly impact mood, cognitive functions, and overall mental well-being. Over to you, Pramila.
Yes. Thank you, Aisha. So, how many of us, can I request audience once again to write in the chat box, how many of us have the any app in our mobiles to take care of the health? Raise your hand, you can unmute and speak, or you can write in the chat box. Do anyone
I
have?
have. I have.
Okay. Any response from the chat box, Aisha?
Yeah, ma'am. They are saying that I have.
Okay. Spandana has
Fit.
raised
No.
the hand. Spandana ma'am, would you like to share? You can unmute yourself and speak.
Yeah, I have app. Actually, you said to raise hand, so I raised hand.
Okay. Thank you so much.
Thank you, madam.
So these days, the digital mental health interventions are also taking a very vital role in mental health as well. As you see on the slide, it is telepsychology or online therapy, which is very much flexible and accessible for the people who are working and who cannot take out for the offline visits. AI-based chatbots, CBT tools, emotional support that we are getting readily available, mental health apps, that is mood tracking, meditation. These all are there these days, which are very much uh, coming into the limelight. So I will just stop sharing for a while and then would like to ask audience, like, we are almost coming to close of this webinar. What are the takeaways for you before I would present on the slide? Can you please mention in the chat box, or you can unmute and speak? What do you think? I would give another clue, as we generally say that prevention is better than cure. Is it applicable even for the mental health? Can I request audience to? Yes.
Yes.
Okay. If you say yes, how? What is your takeaway from whatever slides we have run through? It's an ocean, but we have taken little to understand. Before I present the screen as the takeaways, can I request audience to ask, like, if you say that prevention is better than cure, how should we take care of the mental health? Aisha, I'm presenting the screen. If there is any response, you can just read out for me.
Sure, ma'am.
So we definitely, if we invest our time and efforts for our daily routine, for our mental health, definitely there are so many things that we can prevent. But this session takeaways, we could understand that treatment is becoming personalized and tech driven. Integration of therapy, medication, and digital tools is growing. However, prevention is very much better than treatment. But I would say that when it comes to physical health and the treatment, it is very evident for us. If we fall down, we get any hurt, it is seen. But when it comes to mental health, we carry that for years together. And then we can't just see that some magic happens within a day or within a week or within a month. So let us understand that finding pleasure in doing small things which we enjoy doing it, then definitely the happy hormones will be releasing. At the same time, invite the positive thoughts and keep your brain cells healthy. So keeping ourselves active, getting involved in the family happenings and occasions and gatherings, and then spending time as me time for the relaxation. And whenever we need any help, we can ask for help, and we can be in touch with our friends. We can be definitely be creative, and we can talk about it if we feel something the we have to share or express anything, and then accept who we are, who am I, like that. So that makes more sense for us, and that makes a meaningful life. So I would take you to the 6 principles of kindly excuse. I don't know. It's this is getting stuck here. 6 pillars of health. Every time the Sudisha Counseling Center will be talking about it. Balanced diet, which we are very much aware of it. 7 to 8 hours sleep. 3 to 4 liters of water. And regular exercise, minimum 20, maximum 40 minutes or 60 minutes, depending on our day schedule. These are very, very important for us to take care. Now, coming to breathing exercise, unless even for me, when I don't ask myself to keep everything away, close your eyes and consciously observe the breathing, we don't even realize that how our breathing pattern happens in our body. So once in a while, at least for 2 minutes, or anytime you feel anxious or anytime you feel tensed or anytime you feel stressed, take out just a minute time and then try to consciously breathe and see the difference that you can feel for yourself. And the last one is very, very important for us to understand: regular excretion of the waste. The waste eliminates the body. Being as a biology teacher, I talk this to the students quite very often. The sweat and the urine and the egestion is very, very important to eliminate from the body to keep ourselves healthy. So adopt a very healthy lifestyle, and definitely we can take care of our physical health and mental health, which will be aligned with our social health. I hope that we made it clear. Now it is open for the questions. Geetha ma'am?
Yes, I'm there. I'm there.
Yes, audience. Now,
Uh, Good webinar. You summed up everything, and then the modern modalities and ancient methods of psychotherapy. Everything was dealt very well in detail, and I think this webinar would end the series of webinars which we were conducting since last week. Um, Basically, this series was completely about English. All the mental health issues, overview of mental health issues was dealt in English. And we would be starting the Telugu series of webinars. But today, anybody who understand English, who want to listen in English, if you have anything to ask about mental health, well-being, or therapies, we are here for 5 more minutes.
There are no questions coming up, ma'am.
I think they are appreciating you.
Thank you so
Yes,
much.
yes, yes. So someone was asking, thank you so much. I could attend only today's session. It was wonderful. And Manisha ji, you can always go back to our Manojagrithi channel where you can see the playlist. All the webinars about all the disorders are there. You can watch at your own convenient time.
Yes,
How
ma'am.
to
There
come
is a
out of fear and depression without overthinking.
yes.
See, overthinking is generally a part of depression, and and it is not part of depression. It is part of everything actually. Thinking is a major, thing which decides your mood, decides your emotions, everything. But if you understand the science behind thinking, if you understand the science behind the control of emotions, and you understand the nature of thoughts, nature of mind, it is not very tough to manage your thoughts. Overthinking can be managed. You cannot prevent, because sometimes it happens, but then you can manage it. There are so many cognitive behavior therapy techniques. Simple yet powerful techniques are available. So I think coming in near future, we are again planning to conduct, as I said, stress fit well-being everyday program. So in that, we may expose you to some techniques of CBT. Just stay tuned to us.
There is another question. How to counsel a person who is fine for some time, functional, active, but then boom again, feeling low and tired, as if she never recovered in the first place?
So that is a major symptom of persistent depression, because this will be there for almost 2 years, and sometimes they'll be very much okay for few months, and again it relapse. So this is called relapse. So there are so many ways of relapse prevention. So relapse is very natural, but relapse prevention can be done with a proper knowledge and awareness.
I think, ma'am, you answered this, but still another one have asked, how can we control overthinking?
Yeah, as I said, if you understand the nature of mind, nature of thoughts, if you have awareness about different types of thoughts, then it is not very tough to manage or control overthinking. As I said, there are so many small techniques which can help you. For example, there is a concept called snowball effect, or thought looping, we call thought looping or snowball. So in overthinking, this happens automatically. In the sense, it happens, not automatic, it happens. So if a person is aware of thoughts, conscious about thinking, so if you know how to restructure your first negative thought, you can avoid thought looping or snowball effect. Okay? I
There is
think
another question, ma'am. If a teen keeps saying that he or she is sad and tired, has often have mood swings, what kind of mental health they are having? How to treat them?
see, with this one symptom, or just 1-2 lines, we cannot actually label anybody. like they may be having bipolar, they may be having depression, they may be having mood swing. ऐसा तो नहीं बोल सकते, because this entire series of webinar is for that. We wanted you to understand that proper diagnosis is very important. Assessment is important. We cannot do the self-diagnosis. So with this small info, we cannot tell that this is a problem, but definitely what I can tell you is there is a way out to help them. You can always help them with proper guidance and proper well-being techniques, or having a psychologist or a counselor in-house for your team. Definitely you can work for them.
There is someone who is asking where is a clinic. In case I have to recommend it to anyone, I'll present my screen and share about Sudisha Counseling Center.
Yes, you can do it little later. So any questions? Otherwise, we'll try
No,
to.
other
No,
question.
right? Okay, then. Yeah, you can show it.
Yeah, so I would like to mention that Sudisha Counseling Center, you can see the address here, Kondapur. Ma'am, who are asking the address, you can take a screenshot as well. Otherwise, even if you type in the Google, the map will be shown with the complete address. And the services offered are a wide range of services tailored to meet the diverse needs of the clients. These services include individual counseling, couples and family counseling, child and adolescent counseling, group therapy, workshops, and training programs as well. And also, the services are part of the Sudisha. Geetha ma'am, under Geetha ma'am's guidance, the IQ assessment, personality assessment and psychometry, ADHD assessment and support, behavioral assessment for children, adolescents, and youth, developmental assessment for children, learning disability assessment, special education and interventions for children with special needs, depression, GAD, and OCD screening. So all kind of screening and assessments will be taken place where by the expert RCA certified psychologist. So this is all about Sudisha.
Right. Okay,
Now let me
congratulations
also
again, both of you.
Thank you, ma'am.
Before
Thank you.
you end the webinar, congratulations, and also all the best for the Telugu series coming up. And the participants who are there in the webinar group, please stay back and try to listen in Telugu. You may get another, a different insight into the disorder, because today there is like people who are multilingual. We can understand Telugu, we can understand Hindi and English also. So better you listen from in different languages so that you understand more. Okay. So thank you so much, and over to
Thank you,
both
ma'am.
of you to summarize and conclude.
Yes, ma'am. Thank you. The slide is reflecting with the free webinar series in Telugu, starting from 4th August to 19th August. So do share this information to your near and dear ones and in the group so that the maximum people gets benefited from this, having little awareness about mental health. Thank you so very much. And then keep smiling. We'll see you in the Telugu webinars again. Thank you all.
Yeah. Thank you.